Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Coronavirus Task Force and Chair of the Metro Board of Health. We will also be joined today by Rebecca Kelly. She is the State Director of AARP, as well as Jackie Schrago, volunteer with Get Covered Tennessee. Also today to help answer your questions will be William Swan, Director and Chief of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Health for the Metro Public Health Department. We'll begin with Mayor Cooper.
Good morning, Nashville, and thank you for joining us this week. I'd like to start today by recognizing the Davidson County Election Commission and all of our 1,900 poll workers for their great work in pulling off another election during this pandemic. They even had a solution for COVID-positive voters, and they did tremendous work in this most important civic process. I'd also like to recognize all who voted, either in person or through the mail. We had 254,000 early and absentee votes here in Davidson County. Even in a once-in-a-lifetime pandemic, a record 308,000 Nashvillians voted. Now, last weekend was a busy one for our public health enforcement teams, which checked in on Halloween festivities across the county. And I'm thankful for the hundreds of thousands of Nashvillians who prioritized safety and found safe and creative alternatives to celebrate the holiday. We will need to practice even more of that discipline because our metrics are still a concern. You've seen the numbers, you've read the news, the virus is on the rebound, and we're seeing another surge in cases, and it's expected to last at least through the winter. Our rolling 14-day average of new cases is now 266, and our new cases per 100,000 residents is over 40. It's worth noting that our rate of transmission has ticked down slightly to 1.05, and this declining forecasting metric is an optimistic note. But the current spike presents a new challenge, a new threat to our community. Since March, we've worked to control the spread of COVID in our community. We've flattened the curve for a while, and then we had a surge this summer. And now, this new surge. Our team tracks the data closely. Our public health experts provide the best advice possible and then adjusts our response based on informed best practices and metrics. But we know the right plan to flatten the curve and get through the winter months of being indoors. That plan includes a robust testing program. There have been over 500,000 tests conducted in Nashville. Metro's assessment centers are a model for cities around the country. We started testing at the beginning of the pandemic with 3 free assessment sites, and we've added mobile testing sites and recently additional testing sites at certain schools on Mondays, Tuesdays, and Wednesdays. Results reliably come back within 24 to 48 hours. Now, testing is critical as we continue to move forward. Nashville's testing is at its highest level since the beginning of the pandemic, over 4,300 per day. Now, this high level of testing provides insight into transmission and gives patients the ability to isolate and not spread the virus to someone else. Additionally, and despite our record level of testing, as you see, the positivity rates are still below the summer peak. Now, 2 important indicators, testing and positivity, are both better than they were this summer. Test and isolate is an important weapon in fighting COVID. So please get tested when needed and isolated if you've been exposed. The Public Health Department also has extensive contact tracing. And now in the middle of our new surge, we rely on contact tracing more than ever. As we move forward, this will help us track the spread of the virus, identifying and isolating potential super spreaders to help keep people safe. In addition to testing, tracing, and isolating, our success here in Nashville depends on masks and sensible capacity restrictions for gatherings. Our enforcement teams will continue to enforce the mask mandate and health orders. We've written citations, and we will write more, but we can't police everyone. We need your help. Our current public health orders, which are stricter than anywhere else in the region, represent a safe, stable, and sustainable course over the next months. But we must remain vigilant and follow medical advice. At restaurants, that means socially distanced tables. It means wearing a mask when you're in a meeting or getting a haircut. We know this is tough, and as we get closer to the holidays, it will be even more important. With many of our children home and some of us working from home, others out of work, sometimes separated from our families and friends, unable to get together for the holidays, this has been painful and hard. And this current surge could make it even more difficult for our health and our economy. But we know what works. Masks work. We can keep the virus from overwhelming the city and our healthcare systems and our economy by wearing masks. I've been asked many times before, don't we need to go back? Well, the answer is right now we don't. We need to focus on being safer. Most of the spread is happening in areas that aren't easy to solve by regulation. Backyard events, family gatherings, trips. That's why, unlike the summer spike, our public health experts are not advising moving back a phase or making big changes to our reopening plan. Our public health officials believe that the guidelines currently in place, when followed, lower the risks of spread. The way we can beat COVID is everyone taking responsibility for their own actions. We need to focus on taking care of each other and taking personal responsibility and doing the right thing. If we just take those precautions, we don't have to move backward. We can flatten the curve, and we need your help to do it. And that's why we're working to provide you with accurate information, with the best advice, with tests if you need it. We're tracing cases, executing our plan to protect the health of our community. We're going to be at this for a while, and we can't give in to virus fatigue. We have a plan that focuses on testing, masks, social distancing, and isolating when exposed. Those principles will get us through this. We will get through this with your help. Now, Halloween kicked off a 2020 holiday season this past weekend, and like you, I'm looking forward to celebrating Thanksgiving, especially after the year we've had. Now, while the very safest holiday is a virtual holiday, we know many people are planning Thanksgiving gatherings. The Public Health Department has received many questions about Thanksgiving and has put together the following guidance. If you choose to visit older relatives and be with your extended family for Thanksgiving, consider keeping yourself to yourself for 2 weeks prior to the holiday. That safety advice means reducing your social contacts to a minimum during that period and not adding anyone new to your social or work pod. Consider getting tested 2 or 3 days before you visit a high-risk relative. Traveling in your own car, alone, or with others in your household is another safety precaution. The Public Health Department would recommend that there are additional safety in limiting Thanksgiving gatherings to 10 or fewer. Thanksgiving can be a super-spreading event unless we are very careful. Now, Rebecca Kelly, the State Director of AARP Tennessee, will share her insights on how to have a safe and COVID-free holiday gathering. Rebecca represents an inherently high-risk group, and keeping our seniors safe is our most important goal for Thanksgiving. I'm also pleased to welcome Jackie Schrago, a volunteer with Get Covered Tennessee, a nonprofit organization that helps navigate the healthcare enrollment process. More than ever, health insurance is important. She will share information about the federal health insurance marketplace open enrollment period that lasts until December the 15th. And finally, let's move to the best part of the press conference, Nashville's Community Hero of the Week. Today marks our 85th COVID-19 press conference, and our Community Hero of the Week has been with us for almost all of them. Amy Lankate is a nationally certified American Sign Language interpreter you've seen here since March. Today, she is taking some much-needed time off, but I'm sure she is watching. Amy is an interpreter for Bridges of the Deaf and Hard of Hearing. She mentors interpreters who are entering the field, leads workshops, and advocates for equal access for those who are deaf, deafblind, and hard of hearing. I want to say thank you, and also to all the ASL interpreters who are volunteering their time to make sure all Nashvillians have access to the information they need during this pandemic. And thank you, Nashville, for spending time with us again this morning. And I'd now like to turn it over to Dr. Alex Shahanger, Chair of the Metro Nashville Coronavirus Task Force. Alex?
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 36,089 total cases from the beginning of this pandemic. That is 390 new cases since reported yesterday, and our active cases are 2,425, stable as it was last week, which we reported 2,411. Our rolling 14-day average of new cases is 266, up from 221 last week. Our 7-day average of new cases per 100,000 residents is 42.4, up from 35.5 the week before. Our 7-day case positivity rate is 8.3%, up from 6.9%. And as the mayor pointed out, we have had over 530,000 Nashvillians tested since this pandemic started, 24,000 of which were just last week. 316 Nashvillians have died for a mortality rate of 0.88%. Davidson County is ranked 48 out of 95 in the state of Tennessee for disease activity. Our transmission rate is at 1.05, down from 1.22 the week before. This improvement makes this key metric go into the yellow, and it's encouraging. Now, as a reminder, the transmission rate is the number of people a single individual will infect once they get the virus. Ideally, it needs to be below 1 to show that the virus is slowing. Also, it is important to remember that transmission rate is a leading indicator of the key metrics. It's the first one to show improvement and worsening. And as we have seen, as we get to below 1, the rolling average improves, and then hospitalizations improve last. Regarding hospitalizations, our hospital capacity in Middle Tennessee is 14%, and in Davidson County, it's 7%. And our ICU bed capacity is 11%, and in Davidson County, we're at 9%. The number of people currently hospitalized with COVID in Nashville hospitals is 249. Now, this week, we hit our record high for people hospitalized in Davidson County hospitals at 252 individuals on Monday. While this is high, the hospitals are handling the rise in the COVID patients. Now, I've talked regularly this week with leaders of our hospital systems, and they report that they are keeping up with the patients who have COVID, as well as with the normal demand that they have for other conditions. And remember, since we are a hub of healthcare for our region, Nashville's hospitals see patients from all over our county. The good news is most of our surrounding counties have now reinstated their mask order, and we see that this is working. Now, this chart shows the daily number of new cases per 100,000 for Davidson, Montgomery, Rutherford, Sumner, Williamson, and Wilson counties. The dark vertical line shows that when the mask mandates were reinstated, and as you can see, every county that has reinstated a mask mandate has seen an improvement after this order was then placed in. And this has a positive impact on Davidson County as well. Now look at the daily new cases in Murray County, a county that does not have a mask mandate. During the same time frame, the daily new cases per 100,000 continues to increase for our neighbors in Murray County. Murray County is currently ranked 5th out of 95 counties in Tennessee for disease activity. Now, we're not where we need to be, but this shows that if we remain vigilant, we will get there soon. We know what to do. We need to wear masks and stay out of crowds. And we need to get our flu shots. This will prevent having a big flu outbreak on top of COVID-19. So everyone, please hear it from me now. Please get your flu shot if you have not done so yet. Nashville, I'm very grateful for what you have done. Please stay focused as we enter the next phase of this virus and as the winter season comes on. I now would like to introduce Rebecca Kelly, the State Director of AARP.
Thank you, Mayor. Mayor Cooper and Dr. Jahangir and all that you all are doing to help keep Nashvillians safe during this time. We appreciate you very much. As we approach the holiday season, I know for many of us that means spending time with family and friends, and that includes older adults. But we don't have to cancel the holidays this year. It'll be different, but that doesn't mean that we have to give it all up. Safety is first. Our own safety and that of older adults must be first. But we must also consider the mental aspects of isolation and canceling holiday traditions on our loved ones. We can focus on the most meaningful traditions and find ways to connect, even if we can't do that in person. It's so important to communicate with family members and friends ahead of time. If you do choose to get together, be clear about expectations, wearing masks, setting some ground rules about distancing, opening doors and windows if you can't be outside. Each family member might bring their own food, or one family member might serve all of the food. Feel free to use disposable dishes and silverware. We can get creative about ways to adapt holiday traditions. One example is that we might set up a Zoom meal. We don't have to all be in the same room, eating the same dishes from the same bowl. We can make those traditional dishes and eat them separately while we are enjoying each other on video. If your loved one is in a facility, connect ahead of time with the staff. See if it will be okay to sing Christmas carols outside their window, or make large signs, or things that will help them remember the holidays. Send cards and notes. Have children do artwork and send that ahead of time. And then it's important to plan ahead. Schedule frequent technology visits. Set up visits outdoors, at their windows, drive by, things that everyone can look forward to. At this point in the pandemic, frequency of communication is so very critical. And don't forget, when your family gets together, it's a great time to talk about the care of your loved ones in the future, next steps. If you haven't already started those conversations, do that today. And as much as possible, include that loved one in those conversations. For more information and ideas, feel free to go to AARP's website. That's aarp.org/caregiving. And enjoy the holidays.
Thank you, Rebecca. Now we will hear from Jackie Schrago with Get Covered Tennessee. Jackie.
Good morning. Thank you, Mayor, for allowing us to be here. As the Mayor said, if you do not have health insurance, this is the time to do something about it. Between now and December 15th, open enrollment is occurring for the Marketplace, for the Affordable Care Act. It has various names, but this is the time to try. I would suggest you call this number, 844-644-5443. A volunteer will answer your call, or if we're too busy, please leave your name and phone number. We will get back to you within 24 hours. You will have a phone appointment with an assister who is trained, and this is a free service to help you select the proper insurance for which you qualify and find the best plan for you and for any family members. We ask you for your help. If you need insurance or if you need TennCare and you are eligible, we will find that help for you. Please remember, the phone number is 844-644-5443. If you need additional assistance or questions, please call or come to the Lentz Public Health Center. They also can provide information. Thank you. Are there any questions?
Thank you, Jackie. We'll begin taking questions. The first is Blake Farmer with WPLN. Blake? The next up is Kathleen Seary with Fox 17. Kathleen?
Hi, good morning. Thanks for taking our questions. So the first one is probably for Mayor Cooper. In an unpublished report, the White House Coronavirus Task Force is urging Tennessee residents to stop gatherings outside of their immediate household until COVID-19 numbers go down significantly, and still list Tennessee as in the red zone. Has anyone here in Nashville been contacted regarding this precaution, regarding this advice? And what is your response to it, especially as Nashville has just lifted some restrictions on bars and restaurants? And then the second question is about the Halloween party last weekend. Have any citations been issued, or are they still being pursued? Thank you.
Well, thank you, Kathleen. I'll answer the first part of your question. We don't get the White House reports here in Nashville. We've heard about it. I think Nashville needs to take a bow, though, because we've been doing, I believe, what the report suggests, and we're showing that you can flatten the curve and you can be open and, I believe, be safe, too. I am told that the White House report really applies to 64 other counties in Tennessee and not to Nashville, because we've been doing a great job here. So thanks for pointing out that we are not subject to this particular White House report, but we need to have a national response to the disease. If we're going to get to the other side of it, we can do that. And then, great job, Nashville. We're doing what is recommended right now.
Yes, good morning, and I'll address the question about the Halloween party from last weekend. We are continuing to work with Metro Police and Metro Legal. We had additional meetings yesterday afternoon. We cannot state what action we're actually going to take because we're ongoing with the investigation, but right now it is a case of deciding which action we are going to take based on the number of violations that may have occurred during the event. But again, we encourage everybody to do your part. If you know of somebody that's having an event like that, stay away from it. And if you're in an approved event, wear your mask and keep your distance. Thank you.
Thank you. We'll go back to Blake Farmer. Your question.
Yeah, Brian, can you hear me all right?
Yeah.
Yeah, sorry about that. I'm really interested in the numbers in surrounding counties. How sure are you all that it's the masks that are leading to a downturn in those surrounding counties?
So I think what I would say is this, like, I think when you look at the graphs that we sent you, or that we showed here, there were numbers that have shown there's a consistent almost time frame. You find when that vertical numbers are going up, there's a vertical line. When that time frame comes, within a week or two, the numbers are heading down. Furthermore, I think the example of Murray County was an example of when mask mandates didn't go into place, how the numbers continue to go up. Now, beyond that, I think what I would highlight is also this. Look at what everyone from the federal level is saying, what scientists and experts such as Dr. Hildreth and Dr. Schaffner locally have said, what we've demonstrated in our own data here in Nashville. Mask work. Right now, masks are the most effective tool we have to fight this virus. This is fact, period. And so I think we've just demonstrated with the graphs that I showed that it's happened here locally. And I think it's been shown nationally in other states that it's been the same way. So I feel very comfortable making that statement. So there you go. Thank you.
Our next question is from Brett Kelman at the Tennessean. Brett?
Good morning, everyone. So I believe the mayor opened this briefing by saying a lot of the new transmission is occurring in places that is difficult to regulate. Personal gatherings, backyard barbecues, stuff like that. Despite that, I am curious what the justification was for significantly loosening the restrictions on barbershops, salons, tanning booths, and slightly lifting the restrictions on bars and restaurants. Even if the new infections are not coming from those areas, do we no longer think that they could be sources of infections? What gave the city confidence to do that when all the numbers are moving in the wrong direction?
Well, thank you, Brett. Let me answer from my standpoint, and then I'd love to hear Dr. Jahangir's view on this. I think there's something very important that came up in our discussions with public health today that people in Nashville should take great confidence in. We have not detected the spread from any event that has been approved by public health. We have 125 contact tracers. They are busy every day working on this. So when public health is involved and people begin to understand that it can be in a spread situation and take appropriate precautions, we are not detecting the spread of disease. If I had a wish, it would be to require people at weddings to wear masks. That clearly is an area where spread happens, and that's hard to do. So part of our outreach today is to get people on their own to understand that the spread isn't happening at regulated events, it's happening in everyday events, and it's their care that is going to keep it from spreading further. And Nashville can have a goal of being safe and open at the same time, but it is done through protocols, practices, being careful. And again, we should all take a lot of confidence in that right now there's no detectable spread at any event that public health has approved. That simple act of being approved and being careful seems to transmit extra safety. Thank you.
And thank you, Mayor. The other thing I would add, I think, as the Mayor says, to reiterate, is contact tracing has shown where things are happening, and it's not happening those things. There's a balance that has been reached, as the Mayor said, between the opening up and safety. And I don't think opening up the economy and public health safety are exclusive. In fact, they are both goals that we need to strive for. And again, what has been shown to work are precautions such as wearing masks and being a little thoughtful about how you interact with others when you're out in public. So I think that's kind of where that decision came from. Thank you, Brett.
Our next question comes from Nancy Amons at News 4. Nancy?
Hi, thank you. I have a virus question and a non-virus question for the mayor. The virus question is, with the coronavirus being so widespread, do you feel confident that your contact tracers are able really to pin the sources? Because there's just so much everywhere. What kind of struggle are they having with finding out where people have been and knowing for sure where they got the virus? The second question for the mayor is not related to the virus. We'd like to hear his thoughts on the judge's ruling in the For Good Government case. Thanks.
Well, thank you, Nancy. If you don't mind, I'd love to get Dr. Caldwell to also to comment a little bit about the hard work of the contact tracers. I mean, it's imperfect to be sure, but they're working hard, and I think globally it is recognized as an important tool, hard as it may be. Again, it's challenging work, but this is a challenging time. And the judge's opinion, I just think it's such an important affirmative decision for Nashville. I mean, it was a bit of a grab bag of hot button issues, but it was not a solution for Nashville. And I'm grateful with our stretched finances that we're not going to have to spend $1 million or $800,000 on something that a judge would later overturn. And the referendum item was not actually a solution for Nashville. We still have to pay our bills. Our tax rate is the lowest in the country, I think, and certainly of any city in Tennessee, and it will continue to be. It will continue to be. But we still have to pay our bills. And ultimately, the referendum, I think the judge focused on the fact that it seemed to promise things that could not be legally delivered. So it's very appropriate to go ahead and get a judicial ruling on something that simply was kind of tricking people into thinking that it was something that could be delivered when it couldn't, and ultimately it would have made our financial situation in Nashville much worse. And so for these reasons, I think the city has reason to celebrate the ruling and get back to fixing our problems and creating a stable financial base. And then we have a commitment to having the lowest tax rate in Tennessee. That is going to happen. Even with everything that's happened, we're going to protect that. That's an important competitive advantage. We're going to manage our way into doing it. And again, all the concerns expressed in the referendum, I think, are being met by the appropriate management steps going forward. But thank you. And then I would love Dr. Caldwell to speak specifically about his whole contact tracing division and their hard work.
Thank you, Mayor Cooper, and hello, Nancy. I'm really pleased that our epidemiology division continues to be strengthened. We recently hired a new chief epidemiologist that's also bringing new leadership to our whole epidemiology unit. We've brought on new technology. We've added something just in the last couple of weeks called teletask, where now we are reaching out to people that are positive very quickly through text messaging, and already starting to do the contact tracing virtually, in addition to the more traditional way of trying to reach people through other methods like phone call and emails. When we do have extra cases that burden us, we also have another layer of protection where we have a contract with the Tennessee Department of Health for another agency called Extend. And we, on occasion, may need to offload some of those cases to that other agency. And we also have addressed some of the language barriers that were identified earlier in the outbreak, and we've added more contact tracers with improved language skills. So we're making improvements every week, and we are ready to handle this increased load right now. Thank you, Nancy.
Okay, our last question comes from Yoon Jong from the Tennessean. Good morning.
Good morning. Question for Mayor Cooper. I wanted to know what stage he was at in deciding Nashville's next police chief. Has he narrowed out all the list of candidates? And the city took precautionary steps but uncertainty with the referendum to stop some spending. And with the judge's order this week, does Metro plan on reversing those measures?
Well, Yehan, thank you. I'll start with the second question first. With such a strong decision by the chancellor, we are back to business as normal as a city. And we're out here to solve problems and manage efficiently and run the city. It was appropriate to communicate that the referendum would cause dramatic changes in the stop in government, but with such a strong chancellor's ruling, I think we can go affirmatively ahead. In the search for the police chief, I think Nashville saw 5 very talented individuals. And now I'm busy hearing from everybody that was involved in the search this week, and then in any HR or national search process, there's additional work to be performed. I'm confident that we'll have a decision in the month of November, as we have said. But again, I think all of us that watched the TV footage realizes that we will have a great chief from a national process, and we can be confident that we are doing that, and we're going to take the time to get it right. I'm also excited about the work of the Policing Commission being also completed this month, so that the new chief will have a blueprint going forward to make us a model of 21st century policing here in Nashville. Thank you.
Those are all the questions we have this morning. I'd like to thank Jackie Schrago and Rebecca Kelly for joining us today. We're grateful for Tim Heaslip and our partners at the Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next Metro COVID-19 press briefing will air on Thursday, November 12th at 9:30 a.m. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.